Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, February 20th, 2023. I'm joined today by Dr. Nicole Rankins, who is the creator and host of the All About Pregnancy and Birth podcast. Nicole is an OB-GYN practicing as a hospitalist/laborist and started her podcast almost exactly the same time we did, right before and during COVID. Even though we didn't know each other or that the other had the podcast, we were covering very similar topics, and both of us were also sharing your birth stories as well. Recently, I came on her podcast to talk about prenatal vitamins as part of my affiliation with a startup prenatal company called Element. That's with 2 L's. Check it out. And that's how we first met. And I think Nicole and her podcast are terrific. So first, I invite all of you to check out her podcast. Also, we decided to do like a home and away doubleheader where I would come on her podcast and she would come on this one. So today's podcast is me as the host and Nicole as the guest. She's really fascinating, and I'm guessing if you like this podcast, you're going to like hers as well. Reminder for all you listening on Apple or Spotify, I would really appreciate it if you could rate this podcast, preferably with 5 stars, and leave some comments. I want to give a shout out to one of our listeners. I don't know who you are because, it's an anonymous post, but basically we got a thank you on one of the reviews, and I'm going to read it. I just listened to your most recent episode on periviable birth, and I'm so appreciative to have you talk about this and how complex and hard the decisions surrounding our babies are at this stage. I truly have never heard anyone discuss this in a public space and saw my experience reflected in this conversation, which actually felt very validating. I had great counseling from our doctors and understood, as well as anyone in that situation can, all the pieces you discuss, but I'm pretty sure most of the people in our lives don't understand what the birth of our son at 23 weeks, 6 days was like, and the 8 hours that followed it, where we had to decide to redirect care and allow him to pass away peacefully with us. I'm sure as doctors you are extremely busy with your work and your own families, so I just wanted to let you know I appreciate the time you put into your podcast to educate and share knowledge on topics most people are uncomfortable talking about. Well, thank you to our listener who put that. God bless you. I'm sorry you went through that, but I really appreciate you reaching out, and I'm glad that our podcast could help even just a small bit. Thank you all for listening. Have a great week. We'll see you next Monday. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OB-GYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Dr. Nicole Rankins, welcome to the podcast. How you doing today?
I'm good. Thank you so much for having me. I'm excited to chat.
Yeah, me too. A couple of podcasters just chatting away. Yep. Beautiful stuff.
Yes.
So you are the host of the All About Pregnancy and Birth podcast, as well as other achievements and endeavors that you do, but we'll talk about that. I guess we got connected originally through my association with Element, the prenatal vitamin, and I was on your podcast in that capacity. And then, I don't really actually listen to a lot of podcasts, interestingly. And then I sort of found yours and started to listen. I was like, wow, this is really good. We're like separated at birth, the two of us, which is cool. So I thought we would do like a home and away thing where, you're going to come on my podcast and I'll come on yours, and we'll let each other's listeners get to know who the other one is. And I think it'd be pretty cool. So thank you.
Yeah, absolutely. Yeah, because I think that a lot of times I hear people say that they think that I am rare in terms of the way that I practice and approach medicine. And I like to tell people I'm not rare. There are those of us that are out there. I don't think, we may not be as well known, and maybe there aren't as many of us, but I definitely want to, reach out and connect my audience with more people who practice similarly and have similar beliefs. So
that's great. Good stuff. So you're an OB-GYN, you're a wife, you're a mom, you're a podcast host, you're a course creator. You're everywhere. You're ubiquitous. How did you get into that?
Yeah. So I actually started out in academics. I thought for sure I was going to be a clinician researcher. After I did my residency at Duke, I went up down the street and did a research fellowship at UNC Chapel Hill, got an MPH. 100% thought I was going to be an academic. And then I got into academics and realized that it was not the right fit for me. So I was actually there for 7 years. And research just was not working. And it wasn't until my chairman at the time kind of mentioned that it was suggested that maybe I should be fired. That
it was suggested. Hey,
that I realized, okay, that, I got angry and said, well, you're not going to fire me. I'm going to quit. And as things happened, I was going to my own gynecologist appointment. And it's like long story short or short story long. I was going to my own gynecologist appointment. And she said, hey, at the hospital, we have this opening for a hospitalist position. She just happened to talk about it. And I looked into it. And then we didn't want to move. My husband was like, we're not moving. You've got to figure out something here if you're getting a new job. And I started as a hospitalist. And I love being a hospitalist, love being just focusing on an OB. I love it more than I ever thought I would. However, I was missing some ability to connect with people in a different way. And I also always, in the back of my mind, knew that people were looking for information online and in different places, but we as OBs weren't present in the places where people were looking for information. So I initially started at blog, and then that transformed into a podcast, and because the blog was too hard to write and keep up with. And I'm an avid podcast listener. Mm-hmm. So I said, hey, let me see what it's like to start a podcast. And then now here we are.
Wow. So I have to ask you, going back to the beginning of that story. So you went from Duke to North Carolina. So what's the deal? You're a Blue Devil or a Tar Heel?
I'm a Blue Devil.
You're a Blue Devil.
Through and through.
Okay.
Through and through.
Through and through. Okay. That's
I had the best experience. Not that I had a bad experience in Chapel Hill, but I had a great experience in residency. I still have a group of friends from residency that we meet up every couple of years or so. So I am a Blue Devil.
Yes, yeah, so I've no skin in the game with Duke, North Carolina. However, I've always been torn in my life because I'm a big Michael Jordan fan because I'm from Chicago. So that would put me in North Carolina. But also in my formative years was like 91, 92 Duke, Grant Hill, Christian Laettner. So I'm kind of both. So I guess if I moved to North Carolina, everyone would hate me. So I don't know. So how'd you get into medicine originally?
Yeah. So my undergraduate degrees are actually in mathematics and mechanical engineering. And in the process of starting my engineering degree, this is going to sound crazy, but I swear it happened. I was in the dorm and I was like in the bathroom, standing at the sink, and looked in the mirror, and I saw myself wearing a white coat. And that moment planted the seed that maybe you should be doing something different. And I just started looking into medicine and medical school, and it just became very clear that that was the path that I wanted to go on. And so I did all things, went to medical school. And even in medical school, I didn't, life is the series of events that happens. I didn't even think I was going to be focused on OB. As a matter of fact, I wanted to be a GYN oncologist, like 1000%.
So you're a gunner. All right.
I am definitely a smart cookie and a high achiever kind of girl. Yeah, for sure.
Was anyone in your family in medicine, or were you the first one?
Yeah, that's a great question. So no, I'm the first one. My dad did not finish college. He was a hardworking manager at UPS that didn't graduate from college, but outstanding work ethic. So if you're on time, then you're late kind of guy.
Yeah.
My mother taught math for 50 years.
Wow.
Yeah. And I have a sister who's an assistant principal. Everybody else in my family's in education. Both my sisters in education, aunts, cousins in education. So I'm a little bit of the eyeball.
So you're basically the one that they all ask their medical questions to.
Yeah. They asked everyone, they asked me the medical questions, and their conversations around like education stuff and the lingo. I'm like, I don't understand any of this. So.
Wow. Yeah. It's interesting. So I have a lot of doctors in my family, and it was almost the opposite of what you had. It was sort of assumed, and I really assumed like in a bad way, that I would go into medicine. I just always thought I would. And I almost had to stand in the mirror and like make sure, like, do I really want to do this? Because it was like the opposite from you, but it worked out great. So at least in my family, though, the questions, the free medical advice gets spread amongst multiple people. So I'm not the only one. So
you're not the only one. Yes, exactly.
Yeah. So what did shift you from GYN oncology to OB-GYN?
Yeah. So I knew I wanted to do something with my hands. Like I always like to operate. So that's why I kind of was drawn towards GYN oncology. But it just became, as I got through residency, it was like, this isn't quite the right thing for me. I think I'm going to go into general OB-GYN to do, clinician research route. Like I just thought I was going to, like I said, I was going to be an academic. And honestly, the hospitalist part, just focusing on OB kind of fell into my lap. But I was never quite satisfied being in the office. I always found it overwhelming. In some ways, I felt like I was just a pap smear factory. Like I didn't have the opportunity to spend time with patients. And I was always behind, and I didn't have control over my schedule. So that part clinically didn't feel great either. So definitely as a hospitalist, there are some pluses and minuses, but I love what I do lots of stuff with my hands, obviously, with deliveries and whatnot. So it is absolutely the best fit for me.
Yeah, but I could see what you're saying, that the hospitalist gives you sort of that action, so to speak, and you're always, doing a lot and you're busy and you're working with your hands. And on the other hand, like you said, when you're a hospitalist, it's just people come in labor, you deliver them or not deliver them, and then they leave, almost like an emergency room doctor for a labor floor. So I guess you wouldn't have, you're obviously very personable and you're a talker and you explain things and you like to teach. So I guess what you're doing now is sort of how you connect with patients from a more long-term perspective than just the ones you deliver.
100%. Yeah. So this what I do outside of the bedside allows me to connect with lots more people and support them during their journey and experience in a way that I can't do for everyone at the bedside. So it's not quite like having that continuity to seeing the same patient over and over again. But I certainly get messages of people saying things like, I followed you my whole pregnancy. Even I heard your voice in my head while I was going into labor, that kind of thing. So it's definitely, it's so rewarding. It's like been one of the greatest joys of my life. Really.
How did you actually start? Like, how did you make that, jump in the pool decision to do this? Like, let's say to do the podcast.
Yeah. So I found that I don't do very well with like a lot of idle time. I initially, and I get like my story is kind of all over the place, but I actually started off thinking I was going to do health coaching. So health coaching is like a way to help people change healthy habits. And that was one thing that I thought was missing in the office. Like we tell people to go weight, but we don't actually tell them how to do it. So I actually went back to Duke and got trained as an integrative health coach. And that gave me a perspective of like approaching health from a more holistic way. But it was actually really hard to put that in practice. And again, it still wasn't quite the right fit. So I found the marriage of like my OB world and then doing a podcast, which is what I love, and doing it that way. But the thing that just made me like take the leap and jump, it's easier for me to say like, I couldn't not do it. When those voices are in my head that say, this is something you need to do, I just go forth and just try it. I was like, in the worst case, it'll be a disaster and I can stop. But I never want to look back on my life and say that I didn't do something and wonder what would have happened. I'd much rather say I did it and it failed or it worked out. So, yeah.
And did you have anyone or any podcast that you sort of modeled it after? Or did you just come up with your format on your own?
Yeah. So I just came up with the format on my own. I knew that I learned a lot from, I don't know if you know Pat Flynn. I don't know how I even got to this podcasting stage. You Google how to start a podcast and he had this guide that kind of walked you through how to think about starting a podcast. And as you know, actually doing a podcast is not terribly hard. The consistency part and keeping it up is the hard part, but starting is not terribly hard. But I knew from the beginning, I just thought through, it's like, I want to talk about birth stories just because I know people like to hear about those. I knew I wanted to talk about topics and I'm at my core, I'm kind of nosy, I should say.
Tell me more about that.
I just want to know more about different things. Like I like to learn about different things and different people's perspectives about things. So I was like, I want to interview people about what they do and their things as well. So that's how I came up with rotating between birth stories, me talking about topics, and then interviewing people about all kinds of interesting things.
And did doing the podcast and getting busier with it and more successful with it, did it affect your clinical practice in one way or another?
I think it has made me a better clinician for sure, in the sense that, especially the birth story, we so much get into, like, we do this a lot, and it gets, I don't want to say routine, but in some ways, the newness of it wears off. But I realize that for every single person having a baby, this is a new experience for them. This is something that they haven't done before. So just helping me remember that when I go to the encounter, I think really helped me to listen, slow down, answer people's questions a bit better. Clinically, I haven't backed down in my clinical practice yet. I do hope to back down a little bit in my hospitalist practice, but it definitely has made me a better clinician for sure.
And do like your colleagues and maybe your community, do they all know that you do this? Do they sort of, follow you? Do they poke fun of you from time to time about things, or, how does that work?
Right. Yeah. Interestingly, even though I'm on social media and I talk on a podcast, I am actually an intense introvert. So I would much rather talk in front of 1,000 people where I don't have to do a lot of one-on-one interaction than be in a group in front of 10 people. I'm not like a social butterfly kind of person. So I've never mentioned that I had a whole other separate thing going on. And it wasn't until it started getting more popular, and then people came to me and was like, wait a minute, you're on Instagram. You got 10,000, 50,000, what are you doing? Why haven't you told us about any of this? And it's just not my nature to really talk about it. But more and more people do know. I've been starting to segments on my local news channel, so people do see me. And occasionally I have patients come in more frequently that know me either from my podcast or social media. Some are quite surprised. It's like, oh, you're actually in Richmond. I had no idea that you were in the same city that I was in, because I don't talk about it. But yeah, it's definitely starting to be more well known. And lots of my colleagues refer patients to my information as well.
Oh, that's great. That's pretty cool. So let's talk about the podcast. We'll start there. So what kind of topics do you cover, or guests do you have? Sort of what is your, I don't know so much format, but sort of what's your overarching, maybe your outline of your goals or something like that?
Yeah. So for the birth stories, I like to include lots of different types of birth stories to give a comprehensive approach or comprehensive view of birth. So we'll have anyone from completely unmedicated birth, came in, had a delivery very easily, to the other extreme. I've had people come on and share their experience with stillbirth. So the whole gamut: epidural, no epidural, primary C-section, elective C-section, all of the things, to help people see all of the possible things that can happen. So those are the birth stories. And so it's some good, some not as good in terms of the experience. For guests, I really like to, I'm a little bit selfish in the sense that I will also interview people that I want to know more about. So for instance, I wanted to know about birth photography because I see people do it. So I had a birth photographer come on. One of the most popular episodes of The Guest has actually been getting your dog and your baby to get along after you have a new dog. So that was the interesting thing to talk about. I've had someone come on and talk about nutrition or supplements. I've talked about obesity. I've talked about preterm labor, all kinds of things. So the episode with you, with Element, that was just bringing information to people about something that they may not know about. So I also have guests on who I think are talking about things that are interesting and people may want to know more about. I've had acupuncture, someone an acupuncturist on, a chiropractor on, a prenatal chiropractor. And I'm very honest and straightforward that hey, I don't know how I feel about this whole chiropractor thing, but let's talk about it.
Right.
So it's really about me learning and sharing that information with others.
It's so interesting that's sort of what you landed on. Again, we've never met, and I didn't know about your podcast before we started ours. Actually, I don't even know which one started. When did your podcast start?
Early 2020.
Right when COVID hit, give or take?
Just about, yeah.
So we started the exact same time, which is also a crazy coincidence. And we landed in the same place because literally we did the same thing. We had birth stories and we had topics and things I do know about, things I don't know about, guests that I knew, guests that I didn't know. It's so interesting. Wow. How about that? Go figure.
Yeah. Yeah.
Did you have any podcasts that were maybe not well received or controversial ones, or people, were emailing you like, what are you doing?
Oh yeah, probably the first. I actually redid it a second time, but the first podcast episode that I did on obesity and pregnancy was really like negative. Like I talked a lot about some of the difficulties and challenges, and some people were like, I felt really bad after I listened to it. I don't think I did a good enough job of balancing like the realities of obesity and pregnancy with trying to make the best of the situation. So that one probably sticks out as one that I missed the mark with that. And when I re-recorded it, I think it came across a lot better.
What would you say is something you really learned from being a podcaster or doing these podcasts, either in life or in medicine?
Yeah, you to some degree you have to have I don't want to say thick skin, but you really need to be open. You need to be willing to admit when you got something wrong or when you need to improve. I really think people respond to that. I don't think people want to see someone who's perfect or, like social media glamorous or whatever. I have found that people really appreciate my honest perspective. And when I admit that I have done things wrong or I have grown as a physician, but I really am trying to do better, people give me some grace for that. Like, for instance, I completely used to roll my eyes at birth plans, and say that was like, your express ticket to the OR, your birth plan, nonsense. And then now I've like come full circle and actually have a class on how to help people write a birth plan in a more effective way. So I think people appreciate that honesty and my willingness to say that I've done things wrong and I want to do things better.
Yeah, I mean, we're only perfect on Instagram. That's what we've learned. Everyone's perfect on Instagram.
Yeah,
and then,
exactly.
Yeah, then you scratch the surface a little bit and you realize, I think it's really true. And it's interesting. Do you share personal details about your life on your podcast? Like, would your listeners know, the names of your kids or, your husband or, things like that?
Yeah, I don't share the names of my children. I do share the name of my husband. My husband's name is Falcon, so that's kind of easy to remember. Falcon, like the bird. I occasionally share pictures of my children on Instagram. Not a lot because they don't like to be on social media, and I respect that. I do definitely talk about my birth experience with my first, because that most certainly has influenced my what I do and my work as an obstetrician.
In what way?
Yeah, so she had duodenal atresia. I was a complete nutcase during my first pregnancy. Like, I was ultrasounding myself in the beginning. I was like, just nervous and anxious.
And you were already an OB-GYN at the time?
Already an OB-GYN. I
Okay.
had just finished residency.
You see, I had the advantage of being an idiot because I was a medical student, so I knew nothing.
Okay.
Which is better.
Okay. Yes, it really is. It really is. So I was finally like less anxious. I was like, okay, calm down, relax, take a deep breath, go to an ultrasound appointment. And that's when she gets diagnosed with the duodenal atresia, which is a rare thing that happens. But then, of course. And they're like, well, it's going to be okay. Most of these babies are born full term. They get surgery right after they're born. They're in the hospital for a few days and then they go home and they're fine. The surgeon was like really optimistic. So I was like, okay, good. Okay. I feel better. And then I went into labor at 32 weeks. And subsequently delivered via C-section because her heart rate was just dropping like crazy. So
you're such the typical OB-GYN, all right, there's an abnormality in ultrasound. I have preterm labor and I'm having a C-section.
Yeah.
That's our joke. If you're in medicine or you're an OB-GYN, like, you're screwed. That's it.
Exactly.
It's all happening to you.
To add on top of that, my epidural was not affected. So when they did the Alice clamp test and the C-section, I felt it. And they went ahead and started because
they had to.
Heart rate. Yeah. And it was traumatic, honestly, to be honest with you.
Yeah.
And then next thing I knew, I was like, feeling out of it. I was like, I looked up at the CNR and I was like, oh, you just gave me some happy drugs. And then I was like, out. So, but that first part was really challenging. I actually doubted myself and my experience and like, was I being dramatic? Was I like, was I just being a drama queen and then it's when I had my second C-section, and that was a whole nother experience. I was like, oh, this is what it's like. Like, you don't feel anything. Like, I was not crazy. The first time I was actually feeling things. Yeah. So my daughter spent a month in the NICU. That was trying times. I cried every day while she was there. And she's 15 now, she's doing extremely well, but those beginning times were challenging.
Yeah, no, that is hard. And I think just for our listeners, when we talk about unmedicated birth, we're usually talking about a vaginal birth, not so much a C-section, unmedicated C-section. That's not really a thing in the past couple hundred years. We sort of have avoided that. Wow.
Exactly.
Wow.
Exactly.
So obviously that will inform a lot of what you're doing and the advice you're giving and the thoughts you have about childbirth and pregnancy and
for sure,
anxiety and everything.
The hard stop for me in a C-section, if a patient is saying she's hurting still, I'm like, we got to fix this.
Yeah.
I know what this feels like. And then I've certainly related to, I don't like talk a lot about it unless it feels like it's a natural place to talk about it, about how hard it is to have a preterm baby who's in the NICU and how difficult that can be, and just offer some hope that on the other side things, you never forget that it gets better.
It's great. So let's talk about your birth plan class. So you were a doubter at first in the birth plans, as I guess many obstetricians are. Well, what was it that turned you around to it, and how do you use sort of that original doubt in helping people plan a birth plan?
Yeah. So the first thing I say, the class is titled Make a Birth Plan and all that. The first thing I say in the class is that we can't actually plan birth. None of us can. Doctors can't. Doctors will say, oh, we'll just induce you. But none of us have control. The baby has control. They don't really tell us when they plan to come out. So I reframe it. And of course, you should have wishes about how your birth should go, but we can't plan it with any certainty. And really the key is understanding that the hospital where you're giving birth and your doctor or your practice are on the same page about the things that you want for your birth. And that's the conversation that you need to have in the prenatal appointment. Handing this piece of paper to someone when you go into labor is entirely too late. You're in the hospital, you're going to be there at that point. So you really want to know going into it that you have the support for the birth that you want to have. And it just opens up a conversation for, to make sure that everybody's on the same page.
Yeah. I mean, we did podcast on birth plans specifically. And really the conclusion that we had was really that the idea of a birth plan is really, have a conversation with your doctor, your midwife, whoever it is. Like, you guys should be in speaking terms. And so it doesn't, whether it's written on paper or not written on paper, whether you number it or don't number it, get it online, don't get online. Ultimately, it's, hey, this is what my thoughts were. This is what, I was hoping for. What do you think? And then the answer is either going to be, I'm 100% on board, or that is unsafe and here's why, or I'd love to offer this, but I just can't because my hospital doesn't have that. What do we do? And if you have someone who you're working with is taking care of you, who you trust, then it'll be easy because you just have a conversation, you figure it out. But if you don't trust that person, handing them like a list of demands is going to make it worse, not better.
Absolutely. I try to emphasize that doctors are humans also. And you want to try to approach the relationship from like, we're working together collaboratively and not demanding. Think about someone comes up to you and like, this is what betters you and this is how it better go. Like, that doesn't set a good tone for the relationship. And that trusting piece, as you mentioned, is so, so important. So really the piece of paper is the least important part of the birth plan. It's really that process of making sure that you guys have a good, trusting, working relationship together.
Yeah, I was going to actually ask you sort of in a related note, as a hospitalist, right, you pretty much have almost never met the people before they show up in labor, unless you happen to have seen them, in triage or something a week before or something like that.
Yep.
How do you develop a relationship or a trusting relationship with somebody in such a short amount of time? Because it really can be, you might be with them in 12 hours. It might be very intense or intimate, and they might show up with the birth plan that they went over with somebody else. Like, how do you do that as a hospitalist? Yeah,
that's a great question. When I started as a hospitalist, I very quickly realized that so much of what we do is people relations. Yes, the clinical piece is important, but so is the people relations, because you have to establish that trust very quickly. So it's really just basic things about showing an interest in that person and the things that are important to them. So I tend to sit down, ask the history, introduce myself, all of those things. But then I also ask, are there some things that you want for your birth that you would like us to know about? And that usually opens any discussion for birth plan or anything that they wanted. I'm very careful about asking permission before doing anything like vaginal exams. I always say, is it okay before we do this? I explain the rationale of things very clearly. And people think that that takes a lot of extra time, and actually doesn't. You can establish things pretty quickly by just showing that you are really interested in this person and them having their best experience.
Yeah, I listen, I think it's true. It's not an issue of time. It's just an issue of taking the time to do it. I mean, you can do it while you're putting your gloves on. Like we're not talking about like 10 minutes of conversation.
No.
It's like, it's 20 seconds or 10 seconds. In the hospital that you're covering, are there students and residents and whatnot?
No, actually they're not. Yeah. So we don't have students and residents in our hospital.
So, I mean, so when they come in, it's you and the nurses taking care of them. Okay. Yep. So that's all the more so you're going to have to develop a relationship with them. You're not just sort of supervising the other people. You're in there. Okay.
It's me. Yeah. And we have a unique situation where the practices in our hospital, this doesn't always happen, but they sign out all of the practices sign out their patients to the hospitalist. So we're like an extension of the private practices in the area. We don't just take care of quote unquote unassigned patients who don't have a doctor. We take care of everyone.
Right. Meaning when that is the plan in the prenatal care, like, hey, we're going to take care of you in the office. When you go into labor, one of these 6 people or whatever it is, the number is going to be delivering you. And we know them, we trust them, we've worked with them, and you have it all set up. Excellent.
Yeah.
All right. So let's talk about your online childbirth class. You do a lot. Yeah. So what's going on there?
Yeah. So I made this childbirth education class, and it took me that was a labor of love. It probably took me 8 months to record this thing, right? And record this thing. It took a lot longer than I anticipated, but I really did it from the perspective of like, I want to provide information that's evidence-based, that's from my perspective as a physician, and specifically about hospital birth. So that's what I talk about in the class, but it covers more than just like what's happening in your body during labor and delivery, labor and birth. It's like postpartum issues that can come up, emergencies that can come up. I talk a lot about actually mindset, because that's a really big piece of labor, how you go into the process, your mindset, your support, having the right support lined up. I'm a fan of doulas because research shows that having someone like a doula improves experiences. So I believe research. So really, I just cover that whole gamut in the class. It was truly a labor of love, but I absolutely love it. And lots of, we're at about 1,500 folks who've gone through the class. So I'm really proud of it.
And so what happens? People sign up and it's just like it's an online lecture series sort of?
Yeah, it's online. All of it's recorded. People love it because they could do it. Well, first off, during the pandemic, for a lot of people, it was the only option.
Yeah.
Like, there were no in-person childbirth education classes. So it really took off during the pandemic. It certainly started to slow down a bit since more people are going back to in-person classes. And now what I'm really definitely attracting are people who still like the online and being able to do it when it's convenient for them. And people really love the ability to do it with their partner, because they have a hard time like dragging their partner to a in-person class, but they will sit down and do an online class at home. And then I have a Facebook group to provide like support, additional like more live support, where I do Q&As and things like that.
Wow. What do you do?
People get lifetime access to it. So they
lifetime.
Then they have it. Mm-hmm.
Wow. All right. So if someone's going to have a long birthing career, sign up with you when they're young and go all the way through to their 9th kid.
Recently had someone who sent me pictures of all 3 of her children that she's had since she
It's awesome.
Yeah, this is we both bought the course. So,
that's cool. What do you do about like either listeners or followers who have a really different approach from you? Do they just like self-select out, or do you try to be like as wide or as broad as humanly possible, or do you just stay in your lane and hope people join?
I tell people, this is my lane. This is how I approach things. If you like it, come on. If you don't, there's lots of other people elsewhere. Like, for instance, I have a lot of people who, I not a lot, but a good number, who will ask me about birth centers or home birth. And I think those are appropriately those are safe options for people who are low risk, and you have to have backup available. I actually reached out to home birth midwives in my community to be a place to transfer, before it gets to be a train wreck kind of thing. But that's not my lane. Like, I can't just tell you what happens in a home birth or a birth center. I can tell you what happens in the hospital and birth there. So that is my lane. And so I'm very clear on that.
Yeah, I mean, similar. I've never been at a home birth, but a lot of my listeners were curious about it. So, we did several podcasts on it, but basically it was just me asking questions, right? And, talking about it a little bit. I mean, obviously I have a working knowledge of it, obviously, but it is interesting. And I don't know, some people get really like offended that you want to stay in your lane, but like, listen, what do I do? Like, I don't know anything about home birth. Like, I can't tell you about it in that sense. But I guess they just stop listening is my guess. I don't know. We try to be as inclusive as possible, but sometimes it's just, like you said, if it's not the right place to be, it's not the right place to be. And that's fine. That's cool.
Yeah. And I learned that honestly, some people, I don't want to speak negatively of people, but some people want to stay. Like, there are some, I'm a big supporter of midwives, big supporter of doulas. I work with midwives. I work with doulas. But there are some people in that community who want to stay in a space of arguing and fighting amongst, the hospital system is horrible. It's just horrible. There's no way that a doctor can be actually supportive, and they want to hold on to that. And I've come to the conclusion that I can't change people. Like, I can't make it my goal to change people's minds. I can present my information. If you find it useful, great. I love to work with different types of people. Great. But I'm not going to be able to reach everyone. There are going to be some people who don't like me, and that's just the reality of it.
Yeah, no, I hear you. I was listening to one of my guests has a podcast, and on her podcast, there was someone talking about home births and midwives, and that person was sort of, as you were describing, like very combative, like how awful hospitals are and how awful doctors are, and, all the things they do. And it's like, oh, whatever, I listened. Okay. And I just sort of wrote the podcast versus an email. I said, it was, not such a, it was kind of pretty biased and not really factually true in this. And she said, why don't you come on and I'll have you guys, debate each other. I'm like, no chance. I'm like, I'm out.
Right.
I'm like, I have no interest in that. I'm not trying to convince her to think like me or, whatever. It's just, I don't know. It was odd. But yeah, I agree. I'm not interested in that. Just, you do your thing. And I don't know, people who follow, they just, they're going to like it, or they're going to listen to it or learn something from it. And that's it. It's not worth the fighting. That's for sure.
And far more. I don't know what your experience has been, but most people actually still want to hear from us as physicians and actually appreciate our expertise and opinion. They just want us to also respect them as individuals and help them come to choices and not just tell people what to do. I still think people really value our expertise.
Yeah, I agree 100%. I think that my father always told me this because he's older, so he's got all his experience. He gets to speak as the wise man, and he told me that when he would see patients, he's a neurologist. He said when he would go around on rounds and see the patients, and there was him and 4 residents and 2 fellows and 12 medical students and 6 nurses and 3 social workers. This that, and he said he'd go in the room. He said the patients always wanted to know what he thought, whether it mattered or didn't matter to them, whether they it was going to affect their care or whether it was the thing that was going to change. He said they always want to know what I thought, and he said, and I could tell you that I'm probably the least helpful person to that patient. The nurses do much more for her. The social workers do a ton more than I'm going to do. He said, but for whatever reason, people really care what the doctor thinks. And I think that's true. But on the flip side, there's a great responsibility with that for doctors to not be condescending and not be my way or the highway type of thing. Yep. It's all right. This is my knowledge. This is my information. I'm going to help you with that. But just that's it, without an attitude. Yeah. And hopefully that's how doctors all are. But everyone's had experiences with doctors or any professional who's not like that. And it can really turn people off. I was actually going to ask you the exact question, since you're basically in authority now, because everyone's listening to you, does that scare you or worry you about all this responsibility you have that you say something and, millions of people are now going to hear it and listen to it?
Oh my God, of course. Yes, of course. It's like, what if I say the wrong thing? What if I, I think that's a natural response. I think I have to be prepared and I'm seeing this more and more people disagree, more people have comments, So yes, absolutely. And I just have to keep telling myself, I'm doing the best that I know how to do. I can course correct if need be. But yes, absolutely. It certainly is scary. But there's a certain amount of both in this and in the bad side of checking egos and realizing that the ultimate goal is to be of service to the people that we're really privileged to take care of. So it can be frustrating if someone isn't listening to what you're saying in a sense. But I've come to realize the best I can do is I have my knowledge, I have my expertise. I will share that freely. And I will share it openly and as honestly as I can and detach myself from if this person listens to me or not. I have shown up in the best way that I can, but that's the best that any of us can do.
I love it. What a delight talking to you. I really enjoyed this. It's great spending time with you, and I love what you're doing and I love how you're doing it. And your voice is so soothing. It's just great.
How did you say this? People say that to me, and I would never have thought that before. But thank you, I appreciate it.
It's you have a great way about you. How do my listeners find you? Where can we find you?
My website is drnicolerankins.com. I'm on Instagram at Dr. Nicole Rankins. I'm everywhere on Dr. Nicole Rankins, but Instagram is my biggest platform, and my podcast is called All About Pregnancy and Birth.
Awesome. Thank you so much for coming on the podcast and spending time with us. I really do appreciate it, and keep doing what you're doing. It's awesome.
Thank you. And I look forward to having you on my show again soon for some fellow episodes as well.
Awesome. Thank you. Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.